Hello, everyone. Thank you for joining us for our group case study presentation. Today, we will be discussing the case of George Lawler and his diagnosis of bipolar 1 disorder. Throughout this presentation, we will review George's background, symptoms, diagnosis, treatment, and discuss several important questions related to bipolar disorder. Client overview and early history. George Lawler is a 35-year-old married man and father of two children. He worked as a successful track coach and sports management instructor at a small junior college. George's first significant mental health concerns appeared during his junior year of college. Although his life seemed to be going well at the time, his experienced symptoms of depressions including fatigue, loss of interest in activities, poor concentration, and social withdrawal. He was treated with antidepressants and counseling and eventually returned to normal functioning. Looking back, George also experienced periods of unusual high energy, reduced need for sleep, and ambitious goal setting. These periods were not recognized at the time but were later understood to be hypomanic episodes. Another important factor was his family's history. His maternal uncle had experienced episodes consistent with bipolar disorder, suggesting a possible genetic predisposition. Course of illness and diagnosis. Over time, George experienced additional depressive episodes. His most recent depression occurred approximately 8 months after hospitalization. During this period, he became severely lethargic, blamed himself for minor setbacks, quit his job, and even expressed suicidal thoughts. Eventually, George experienced his first full manic episode. His behavior became increasingly diagnosed and irrational. He claimed to be a future coach of the Olympic track team and engaged in inappropriate and risky behaviors. George met DSM-5 criteria for bipolar 1 disorder because he experienced both major depressive episodes and at least one full manic episode that resulted in significant impairment and hospitalization. Hospitalization and treatment. When George was hospitalized, he displayed severe manic symptoms, including rapid speech, grandiose thinking, poor judgment, irritability, and a complete lack of sleep. His treatment included medication management using both haloperidol to quickly reduce manic symptoms and lithium carbonate, which is considered a first-line treatment for bipolar disorder. In addition to medication, George participated in group therapy, recreational activities, family visits, and outpatient psychotherapy. He and his wife also participated in conjoint therapy to address communication and family concerns. Although George's symptoms improved significantly, his marriage ultimately ended due to the lasting impact of his manic episode. Discussion 1. Patients with bipolar disorder are often reluctant to take medication because hypomanic periods can feel productive, exciting, and rewarding. If I were speaking with a friend who wanted to stop medication, I would acknowledge that those periods may feel positive. However, I would also remind them that the same mood instability that creates temporary productivity can also lead to severe depression, damaged relationships, financial problems, occupational consequences, and hospitalization. I would encourage them to focus on long-term stability and quality of life rather than the temporary benefits of hypomania. Discussion question 2. One reason bipolar disorder can be difficult for spouses to understand is that many individuals are highly functional between episodes. George was often responsible, successful, and caring. As a result, Cheryl frequently viewed his manic behavior as intentional rather than as symptoms of psychiatric disorder. His public remarks about another woman, poor decisions, and embarrassing behavior created significant pain and mistrust. Because he could appear rational at times, it became difficult for Cheryl to separate the illness from Gerald's personal choices. Discussion question 3. Bipolar disorders and depressive disorders share many similarities, including severe mood disturbances, disruptions in sleep and energy, and impairment in daily functioning. However, the defining difference is the presence of manic or hypomanic episodes in bipolar disorders. Individuals with depressive disorders do not experience these elevated mood states. Research also suggests differences in age of onset, family history patterns, genetic factors, and medication response, supporting the DSM's separation of these disorders. Discussion question 4. There appears to be a relationship between bipolar disorders and high stress occupations. Many individuals experience hypomania are drawn toward careers that reward high energy, ambition, and productivity. Georgia's success as a competitive track coach reflects this possibility. At the same time, highly stressful occupations may contribute to the relapse and increased symptom severity. This creates a cycle in which certain careers both attract and challenge individuals with bipolar disorder. Case summary. In summary, George's case illustrates the classic presentation of bipolar 1 disorder. He experienced multiple depressive episodes, several hypomaniac periods, and eventually a full manic episode requiring hospitalization. His treatment included medication, psychotherapy, family involvement, and ongoing monitoring. This case highlights the importance of early diagnosis, medical adherence, psychoeducation, and long-term support for both the individual and the family members affected by bipolar disorder. References. These are the sources used in preparing our case study presentation. Thank you for your time and attention. We appreciate the opportunity to present George Lawyer's case and discuss the challenges and treatment considerations associated with bipolar 1 disorder. Thank you.